I am Dr. Cynthia Correa Cedeno, and welcome back to Balance Steps. Yeah, and this is my wonderful co-host.
Hi, everyone. My name is Dr. Sondema Tarr, owner of Direct Podiatry Arizona in Tempe, Arizona.
What up? Yes, and I am the owner and founder, CEO, CFO of Orange Sky Podiatry. Yeah, all the teams, all the C levels. Orange Sky Podiatry in Orlando, Florida. And today's episode, season 2, episode 3. It is You Can't Heal What You're Still Surviving. And ain't that a B word?
Yep.
Yeah, it is. Yeah, the truth. We're not explicit here. Um, it's hard to know when you're in survival mode, and then you don't even know you're caught up in it. But it feels like your heart's about to explode.
Your head's about to explode.
Yeah, you just can't do it right. And then being a physician that's in survival mode, I mean, that comes up in your clinical decisions. Even if you want to say, no, I can handle it, that's a lie. Like maybe, maybe you're very high achieving and you're masking yourself really well. But when you're surviving, it is bleeding into every aspect of your life, and it is in your clinical making skills.
Exactly. Exactly. I think also for doctors, it's kind of like it can be difficult to realize when you're in survival mode because honestly I think more often
We're
than
always in
not
it.
a
Yeah.
lot of doctors are existing in survival mode, and we probably have been for a very long time, for years if not longer. So it's kind of like when you're um in a job or in just kind of a field where that is common or more
Mhm.
common than likes to be discussed. When you have certain feelings come up, you're taught just to bury them, just to push them aside, or oh, maybe you're being too sensitive, or that doesn't exist. And then you're taught to ignore your feelings instead of actually addressing them. And that can cause a lot of problems, a lot of serious problems if you do that for too long.
Yeah. Yeah, because it becomes like the fish in water, You tell a fish they're in water, they're like, what?
Yeah.
Um, but there's definitely cues. There's definitely many cues as a physician that you're in survival mode, and um, I didn't know. I knew that something wasn't right, and I didn't feel well, um, and that's why I decided to go down a different route in medicine. And this wasn't alone. This was a whole community
Mm-hmm.
that's behind me because I didn't do this alone. I have my own board of advisors. Yeah, my board of advisories. Like
Mm-hmm.
because the people in my village, the people in my board, they're sustaining me. They're helping me. I don't have negative noise there. So I had a lot of people that showed me, hey, this is possible. This is another way that you can thrive as a physician, because not every physician is going to thrive in the traditional sense. Because I do know some physicians that are just killing it, doing so well, and they love it, and that's awesome for them. But there wasn't a system for me, for a physician like me, that worked out for me, because I did many different jobs thinking, I'll finally find my way, but
Mm-hmm.
I had to make my own path, and that's okay. And I'm finding my own patients, and that's so awesome because
Exactly.
they're being bounced around from place to place, and they're so unhappy and they're not getting better because what they're looking for just doesn't exist in that content. But we are creating it for you because there are people who need that, just like how I needed this type of business system versus the other traditional sense with insurance, in order to get out of that survival mode and become the best physician that I can, and use my skills, my particular set of skills, to help the people in the community.
Yes. Yeah, I think medicine, people always say that medicine is an art as much as it is a science. And I think this is probably one of the ways that it kind of manifests as an art when you decide to leave kind of like the larger, I guess, more well known way of practicing medicine by
Mm-hmm.
accepting insurance and being in that model and kind of being um, just sequestered to offering
Hmm.
certain services, certain treatments. Once you get out of that and kind of like the world is your oyster, and you can start to research more certain things, learn on your own, learning community with other doctors that are practicing the same way. And you can start to bring services that maybe aren't available in your city, that aren't available in your town. Maybe you're one of very few, or if not the first early adopter for a certain service or certain treatment, because you see the value in it, you see the data in it, that is brought to your
Hmm.
community. And that way you can really evoke change, positive change, by just offering different treatments that are not, I guess, readily available to people in your area, but things that people are looking for. People are always looking for certain solutions to those problems. And sometimes it's just presenting it in a
Hmm.
way as an alternative to something that, maybe they're not 100% sold on. And then you offer a more, I guess, just a more agreeable option for them, an option that fits their lifestyle. And they say, hey, I didn't even know that this was a thing, but now that I know, I want it. And that's a
Hmm.
really good feeling to have. Again, just
Yes.
giving people options and giving the public options.
Yeah, it's a different one. Um, and the depth of how much I was surviving and still am, I would have never known on the other side. It just wasn't for me, and it wasn't built for me, and that's okay. Like I
And that's
said,
okay.
some people are just not built for this traditional care, and they are looking for us, and they have the means to pay us. So we're here because I know you're paying all those influencers to get those little oils or whatever to put on you, and I'm like, hey, we can actually help you out, tell you the science behind it, talk to you about the physiology, tell you why this is happening. Go through the whole thing, go through that whole assessment and plan, and reassure you. I'm like, hey, this is something that you can improve. Like this isn't the end all. I mean, I have people thank me because they think, oh, once you get older, it's a wrap. Your feet are gonna hurt, you're gonna have arthritis, and you're not gonna be able to do stuff. I was like, that's not true. I was like, yes, genetics plays a role. Yes, age plays a role, but there's so much within your control. You don't have control over your genetics. You don't have control over your age.
Hmm.
But there's so much in between that you have control over that we can discuss and make a personalized plan
And
for
modify.
you. Yeah, and modify. What I try to look in personally with my patients is to find their inner athlete. You don't have to be Simone Biles, like she's like, it's like excellent. But
Yeah.
everybody has their own inner athlete. And I always try to find it, no matter what age, no matter what phase you are. I want you to move. I want you to move while you are healing. There's so much good research showing that, linking that not only to our physical state, but also to our mental state, because they both work together.
Together. Exactly.
Yes, they both work together. Um, and I try to find that in any person, not discourage them to be like all or nothing perfectionist thinking,
Hmm.
because they can. I know that you have had a few patients like that in your clinic that you've seen, Dr. Sondema.
Definitely, for sure.
Yeah.
Especially when you're dealing with, I think, just like any type of foot issue. Again, I'm not really a fan of, unless it's something like super extreme, of telling people just to be sedentary, especially when they're used to moving. I think both of our practices, because we are cash and because of what we offer, like regenerative medicine, integrative medicine, our patients, we kind of get like a certain type of patient that is drawn to us, a little bit more active, a little bit more, I guess, just day to day movement
Hmm.
focused. So, again, I try to tailor treatment options around their lifestyle and what they're already doing. What they're training for, but also being mindful of, like, hey, you have this injury, you have this inflammation, you have this pain that you're trying to overcome, and let's work within that realm to get you better, and,
Hmm.
like, then slowly ease you back into the volume
Yes.
that you were doing before. But yeah, telling
Yes.
people just to sit on their butt, within reason doesn't really
Yeah.
work for me, you
No.
know. Like it's one thing
Mhm.
if you know broke your ankle, sure, but
That's
if
different.
you're you know then obviously, but if you're dealing with you know a neuroma, fasciitis, something like that, then
It's like
we
I saw you walk in here. Okay, you walked in
yeah
here, maybe with a little limp, but
yeah
you walked in here. You finished a 40-hour week at work. You took care of your children. Okay, you can move. All right, I'm just going to show
exactly
you how to move in a way that still allows your body to heal.
yes
And that
exactly
takes time, and that takes
yeah
and that takes not just time, but really listening to the other person, caring for their needs, and making medicine work for real lives, not them, plugging into something that doesn't work. Like I was like, oh, now I have to change my whole personality. Absolutely not. You're not going to. But
yeah
we can make these little adjustments to make your life better,
mm-hmm.
because this is for you. That's why you knocked on my door. That's why you're paying my fees, because you want to get better and I want you to get
Mm-hmm.
better. These are the things that we can do. And if you answer these three questions, no, I won't know everything. But once I start listening more, your goals, your lifestyle, your what you do socially, and of course all of the other stuff, the medical history, the genetics, and all of that, we can cultivate a good plan. Um, it's definitely possible, but it's intentional. It must be intentional to
Mm-hmm.
make that work.
Exactly.
No, yeah. So it's like still surviving. I mean, leadership begins with the central nervous system regulation, not hustle, which
Yeah.
still amazes me. It still amazes me because nobody ever talked to me that way.
Yeah,
Nobody ever did.
again, I think when
Yeah.
everybody is kind of like surviving and existing in their own way and not questioning like the systems that they're in or what they're experiencing, then I think it becomes normalized, unfortunately.
Yes.
Just existing, hustle culture. And not to say don't work hard, like both of us work hard. We work every
Yeah.
day
Yeah.
at our dreams and goals and, you know, building the life that we want,
Mm-hmm.
but at the same time, you know, like hustling to the point of burnout is not something that we're doing anymore.
No.
You know, that was a big reason for both of us for leaving like the insurance model in general, was because that level of just like hustle every day just wasn't really fruitful. I guess that's the best way to say it for both of
It,
us. It
it,
wasn't
it,
in alignment. I know for me personally, it wasn't in
no.
alignment with the life that I wanted to lead. It wasn't in alignment with, you know, how I saw myself, especially when I was in residency, just, you know, doing all the things. You're in clinic seeing 40 patients a day, you're rounding, you're doing surgery, you're doing all these things, and you're working 12-hour days. I thought
Yeah,
about
my
it like 10 years from now, I don't want to be doing this. 5 years from now, I don't want to be doing this. There has to
three
be
three months from now, I was like, I'm tired. Yeah, it's like I was like, tomorrow, I'm already tired. It just
exactly
I work hard, but I work hard with my central
intention.
nervous system. Yeah, with
Exactly.
intention. Like what makes me feel better, because I do want to work very hard. I do want to build. I do want to create, but I want to respect um,
Yeah,
my central nervous system. So this is something sustainable.
exactly.
So I can see 5, 10, 15, 30 years down the line.
Yeah, and see myself through, you know, many life changes, you know, all the different things that I think work should be something that should be tailored based on the life, you know, era that
Yeah.
you're in.
Yeah.
Like, you
And then
know,
let
for
it.
example, both of us got married last year. So there's
Mm-hmm.
like a pivot or like a
Yep.
tweak
Mm-hmm.
that has to happen because now you have another partner, you know. So there's many kind of like life adjustments that I feel like, you know, you have kind of a good um or for us being business owners, you know, you have like a viable business when that business can be adjusted for the phase in life or stage of life that
Yes.
you're in. If you're continuing to hustle like, you know, you're 25 with no one
Yeah.
being, you know, attached to you, I don't know, but as long as you can tailor and tweak your business
Mm-hmm.
and for us our practice based on where you are or even just interests in general, because we're not the same people that we were when we started school.
No,
then you
now I
know
can,
that exactly that what you're doing is viable. So
yeah, and I can give the best of me to my patients,
yes,
not the worst, because I was giving the absolute worst of
yes,
me, even though they appreciated me, I got them better, but I wasn't giving them the best of me. I wasn't giving the best of myself. And now I can. Now I see different solutions, different problem solving. I look at my charts differently now. I look them like data, and I go back, kind of like what football players do by looking at the tape and seeing what they could have done better, what they did well. Now I have the time to do that and keep increasing my own clinical skills to help out the next person so I can give them the best of me. Um, and now we're coming to the end of our episode. You can't heal what you're still surviving. But thank you so much for listening to us at Balanced Steps. Please subscribe and follow us. And if you have any questions, send us a message. I'm Dr. Cynthia Correa Cedeno.
and I'm Dr. Sondema Tarr.
Have a great day. Bye.
Bye.